Here. So first of all, thank you. Can everyone hear me okay? I'll do my best to speak in a raised voice. Louder? Okay, yeah, thanks. First of all, thank you to the staff for the great work you're doing. We really appreciate it. Frankie's Rafi. Is Rafi here?
Oh, he's in Winnipeg.
He's in Winnipeg, okay. Thank you, Rafi, in Winnipeg, wherever you are. And thanks to all of you for coming out and joining us here. I just want to take a moment to introduce a couple of our candidates, a few of our candidates very briefly. They will say a few words, but I'll just introduce them here very briefly. I want you all to know something. How you win elections is three things that really matter: money, message, and members. Members include candidates. When you have good, high-quality candidates, believe me, it makes a difference. 6 months from an election, you may not think it makes a difference, but 6 days before people vote, it does make a big difference. They really start thinking about, okay, who are the kind of people that are running for this group of individuals? And so tonight I want to, and I'm very proud to, introduce a few of those candidates that are running for us. One is the next MLA from the riding of Chilliwack Cultus Lake, Sunat. And all the way from the riding of Delta North, I want to welcome Amrit Dot. Amrit, thank you. I didn't even know he was going to be here. I just spotted him here, so that's great. Thanks for making it out here, Amrit. And I know, and our latest candidate that I'm very excited to introduce from the riding of Chilliwack North, your local doctor. If you've ever been to the emergency department, you've probably visited David. David Moniz, where are you, David? Are those your kids over there? Those are two of the kids? Yeah. And David's beautiful kids, yay! That's fantastic.
Hello.
Now, I'll tell you why this is important, because I'll tell you why it's important, because I really do think this matters. I want you to know this. Everyone should understand that right now, 6 months from an election, I get a lot of people saying to me, but Kevin, I worry about the polls. What about the polls? What about vote splitting and all those kind of things? And I want you to know I worry about it too. But I also have the benefit of having been around for a while and have some experience. And I remember June of 2012. And in June of 2012, here's what the polls said. The NDP, 50%. BC Liberal, at the time, 22%. BC Conservatives, 21%. Okay? Does that sound familiar to anyone in this room? I'm just asking. Okay, it does, doesn't it? Now, what changed? Well, 2 weeks before the election, I was in the private sector at the time because I retired as finance minister, and I was helping raise some money for my former team in the BC Liberals. And I remember all my business friends said, Kevin, it's 2 weeks before the election. The BC Liberals are down 22 points in the polls. It's hopeless. And admittedly, the pundits and the pollsters had pretty much come to the conclusion it was hopeless. The front page of the Vancouver Province, you may remember this, had a big picture of Adrian Dix. And the headline was, and I remember it, every word of it, the headline was, this person could kick a dog and would still be elected premier. Okay? But guess what happened? We had an election campaign, a 28-day election campaign. And we won a majority government. That's how fast things can change in politics. And so I want you to know that today, when people say to me, can you work with the BC Conservatives? Of course we would work with the BC Conservatives. You should know they've been around for about 80 years. They've never elected a single MLA. And there's a reason for that. They're a small party that's not connected to the federal party. But they have one benefit. Guess what that benefit is? The name. They have the same name. And so a lot of the public right now is confused because they think, oh, Conservative, that's Pierre Poilievre. Good. That's our team. And that's okay, because that confusion will start to diminish as we get closer to the election date. How does it diminish? Well, first what happens is they start to run into problems. Now, small parties have a challenge because they haven't got the resources to vet candidates. We're very careful in vetting our candidates. David, Sue, Emmerich, they have to go through a 40-page application, a criminal record check. We check all kinds of things in their background because we want to make sure we have really good, credible candidates to offer to the public. The BC Conservatives have a bit of a different approach. It's kind of like, who wants to run? If you raise your hand, it's like, you're it. Come on, right? The problem with that is you can run into some challenging candidates. And you saw they just had to fire one recently that thought that, you know, getting COVID vaccines turns you into a magnet and you get stuck to your fridge or something. I can't remember what it was. But the point is that the caliber and quality of candidates really does matter. So just remember that. Now, the other thing that matters is policies. Now, I want you to know we've got some big challenges in the province today. We just spent some time speaking with folks in the social services sector in Chilliwack, the healthcare sector, and believe you me, we have challenges. But here's the good news. There are solutions to these challenges. We just need leadership and people that know how to get to solutions. I'll give you an example. In healthcare, the biggest challenge we have in healthcare right now are 1 in 5 British Columbians cannot access a family doctor. That's a big problem because family doctors, Dr. Moniz, are important gatekeepers in the system because they help connect you to specialists and the kind of care that you need. So if you don't have access to a doctor, you go to typically a walk-in clinic. But unfortunately, British Columbia has the longest walk-in clinic wait times in the entire country. That's a challenge. How do we fix this challenge? Here's the good news. We have literally hundreds of trained physicians that are called international medical graduates. Do you remember this, John? Where's John? Bible. John was my deputy minister of health for a while when I was minister of health. Some of these problems just never change. But these international medical graduates, their only flaw is that they studied outside of BC. It might have been the Caribbean or Australia or Ireland or the United States. They receive exceptional educations and they want to come home to practice. And they can't. They can't because we have all these rules and regulations that have built up over 75 years that make it really, really hard. And I won't bore you with all the rules. I'll just say this. We are going to take a chainsaw and just go through a lot of those rules and bring those young people home to deal with the crisis we're facing today. And we can do that. And we will do that. That's how you start to deal with the healthcare crisis. Now, there's a lot more challenges in healthcare than just the shortage of doctors, I can assure you. One is bureaucracy, something John and I are very familiar with. Guess how many vice presidents we have in the healthcare system? John, you've heard this, so you can't answer. Anyone that's heard this, yeah, you can. If you've heard it, you can. Just take a guess, honestly, people. In BC, we've got a population of 5 million people. Just take a wild guess, anyone. 2,000? Okay. 77, really close. We've got 73, all earning well over $250,000 a year. And the problem is, next door in Alberta, which has a similar sized population, they've somehow managed to get by with 7. And if we had 73 vice presidents and we're getting amazing results, I might say, okay, that's good. They're doing a really good job. But we're not. We're getting the worst results in the country, and we got to change that. We are literally sending Canadians, British Columbians, south to the United States to get basic radiation treatment for cancer care. When when I was Minister of Health in 2009, 2010, and John was deputy, we had the best cancer care system in the country. Nobody argued that. Today, it's at the very bottom. So it's important you understand the change that we need requires leadership that knows how to get the results. And that same focus on results covers every area that we're facing challenges right now. Homelessness, mental health and addiction. I could spend an hour on this subject, but I'll just keep it brief and say this. All of us know we see people on the streets, and it is not compassion to allow people to remain on the streets with untreated severe mental health. It is not compassionate, especially when they cannot make decisions in their own best interest. That's where government should step in and play a role and compassionately get them off the streets into proper 24/7 care where they can be properly cared for, not have families struggling and desperately trying to get them the care they need when it's not available. So we're going to fix that. And then on the addiction crisis, we have to have a response that goes way beyond what this government's doing now. The government's response is to just publicly supply addictive drugs and not just giving out drugs, but then saying let's decriminalize drugs like heroin and cocaine and fentanyl and methamphetamine. And it's created a massive problem right across this province. We've got to do better than that, because now we've got open drug use taking place not just in our parks and our playgrounds and our beaches and our public spaces, but now in our hospitals, under government direction to say you must not do anything about it. And the doctors and nurses are saying, no, we can't work in an environment like that. Patients don't want to be in a hospital in a 4-bedroom ward when someone's smoking meth or crack right next to them. It's not acceptable. We've got to deal with these issues, and we can, and we will. And we'll focus on results and outcomes again on the healthcare sector to make sure we get improved results and outcomes. And finally, of course, in just public safety, we have to have consequences for bad behavior. I always say to people, not every crime deserves jail time. Every crime does deserve a consequence. And that means that, maybe you're going to spend 50 hours cleaning up and picking up garbage in Chilliwack, but there needs to be a consequence for bad behavior, because right now we've got a whole group of folks that have realized there's no consequence to walking into your local supermarket, stealing the best pieces of meat and walking right out the front door without a concern in the world. That happens all the time. Or shoplifting, or vandalism, or assaults, or whatever the case may be. It's gotten out of control under David Eby's catch and release program, so we're going to make sure that we get rid of catch and release and there is consequence for bad behavior. And then people, especially women, young women, will feel safer on the streets, as they have every right to. And we'll make sure we get our streets back to being safe again. So with that, I will conclude and then hand it over to our two candidates here from Chilliwack who are going to say a few words by saying this. And we'll get to questions after. But this is important. All of you are part of the solution. The worst thing you can do is say, that was a great speech, Kev. Go get him. Wish you luck. And then just wander away, right? What I really need is you all to say, okay, we get the call to arms. We're going to roll up our sleeves and we're going to do our bit. And yes, Kev, we worry about vote splitting. And yes, we worry about, whatever it is you worry about. But we're going to get behind you and get to work and keep building the momentum we need so that by the time that election rolls around 6 months from now, we roll over the NDP and we get BC back on track and we fix the challenges we're facing in this province so that we can move forward again and feel confident about the future. Thank you very much for coming out. And over to you, David.
Thank you very much, Kevin. Thank you to everyone for coming out. So as Kevin said, my name is David Moniz. I'm one of the doctors currently working at the Chilliwack Hospital in the emergency and also doing anesthesia and family practice. Now, I grew up in BC. I grew up in Abbotsford, and then I left BC, went to Australia for 14 years to do my medical training, and that's where I met my lovely wife, and we had 3 lovely children. I've been badgering my wife for the past 10 years to try and convince her to move back to BC, because I love BC. I loved it. It was a fantastic place to grow up. I felt it was always the best place to live. Finally convinced her to come back. We come back and it feels like a different place. It feels broken. The healthcare system is in crisis. We can't get help. We can't get care. So many people don't have access to a doctor. The crime is out of control. It's unaffordable to live, and it just felt like a different place. And we got back and I felt like I made the wrong choice bringing my family here. And I want my kids to enjoy living in BC. I want them to love living in BC like I do. And instead of beating my head against the wall, I was like, what can I do? I can stand up and try and help. And I was looking through all the different political parties, and I came across BC United and saw the policies and saw Kevin Flacon and his track record. And I felt this is the party that can do it. This is the party that can make the changes, get BC back to the place that we wanted, that it used to be, back to the place we want it to be, having this is the best place in Canada to live again. Wow. And that's why I decided to put my hand up and run for Chilliwack North, to hopefully be your next MLA to try and get BC back on track.
All right.